Hi, what do you mean by cytokine storm? Because this term is often being discussed in the media, which is related with corona. This can be raised as a question in your upcoming examination. So, overall, before going into the cytokine storm, if we understand the whole mechanism behind the coronavirus, how it affects our body, that will be grateful to understand the cytokine storm very easily. Okay, so let me start from the beginning. So the whole coronavirus and the impact on the human body, it is a kind of 14-day disease. Okay, this probably you all know. So in this 14 days, what happened? So the first, this entire 14 days, let us divide into three stages. Say for example, approximately 5 days each. First, second and third. Totally approximately around 15 days. In the first 5 days, what happened when the virus enters in our body? It enters through the nose as well as the mouth, and it goes and stay back in your throat for a few days, and then gradually it enters into your lung. So in the initial few days, the moment it starts, it goes inside. It start creating the symptoms like a throat infection or a cough, or it may lead to the fever. Okay, this is the initial symptom. So the monitoring this initial symptom, it's very key factor to come out of the disease. Okay, now the virus will take few more days to multiply inside our lung. Okay, now the multiplication process is getting started. At the same time, we have our own immunity system. Each and every human being naturally protected with the immunity system. That immunity system, whenever any foreign bodies enter in our organization, that means in our body, it can be a virus or it can be a bacteria or anything. Immediately, our immunity system will produce antibodies in order to strike down the enemy. It is clear. This is a natural protective mechanism. It is there inbuilt in our body. Now, when the coronavirus entered, the same inbuilt mechanism, it got stimulated. It got stimulated. Now, what happened compared to the other diseases and the corona diseases? Suppose, say, for example, the person is getting a normal cold. It is nowhere related with corona. Even that person will have this antibody reaction by our body. Okay, so it is not something new only for the corona. Don't think like that. It is normally happen for any disease. Now the virus is getting multiplied in your lung. At the same time, our antibodies are getting reacted, and they get started from throughout our body. These antibodies are getting produced, and they started rushing towards the lung, because inside the lung only the enemy is there, that is coronavirus. Now the entire antibodies, when they are coming, you can see it in the screen. The entire antibody will travel through the blood vessels along with the blood cells. Keep it in your mind, in our bloodstream, because only through the blood it is running through different part of our body. So antibodies, if they really want to reach particular destination, they have to take the route of blood vessels. So inside the blood vessel, what is there? You have a blood cells, that is like a WBC, RBC, or platelets. Next is, apart from these three cells, you have more than 60% nothing but water. It is a liquid component of the blood. That is how blood composition is there. Now, when the antibodies are coming, through the blood vessels, when they are reaching the lung, once they reach the lung, they have to pierce. Suppose the blood vessels are like this, they need to pierce the blood vessel wall, and they need to enter inside the lung. That is how the antibodies will enter. So this blood vessel, the walls of blood vessels are like a permeable. It allows the antibodies to move inside. You got the point. Now the antibodies are coming, and they are piercing the walls of the blood vessels, and they are moving inside the lung. Now, suppose if there is a limited antibodies are coming, nothing harm. Limited antibodies are coming, and they are moving inside, and it goes attacks the virus, and the virus is getting destroyed, and the person is cured. Now what happened? It is not the case here in the corona, because the corona creates some havoc in our immunity system. It produces huge amount of antibodies. Instead of 100, it goes in 1,000 and 10,000. So there is a large number of antibodies are produced, and the antibodies are communicating in the different part of the body. From throughout our body, the antibodies are rushing to the lung, and it's piercing the blood vessels, and it is moving inside the lung. During that time, what happened? The damage to the blood vessels will become maximum. You need to understand these processes are happening in the second stage of the disease, that is a second, 5th to 10th days. It is clear. So now in this time, what happened? In this situation, the antibodies are actually moving along with the bloodstream, and it is entered inside the blood vessels wall. When the blood vessel walls are totally penetrated by large number of antibodies, there is a huge amount of pores. There is an opening. Now through this opening, what happened? The liquid composition of the blood, that is also started moving inside the lung. You got the point? So this is the condition called lung inflammation or lung swelling. You got the point? The people reaching the hospital in the second stage with swelling in the lung. That is why the doctors used to advise them to go for a CT scan. In a CT scan, you will come to know exactly where the trouble is. It is clear where the lung is getting infected. Why the infection? Antibodies are rushing inside the blood vessels and inside the lung. Along with the antibodies, even the liquid components are keep moving inside. When the liquid components are moving inside, what happened to the blood vessels? The blood cells are slightly bigger in size. They remain stuck inside the blood vessels without any liquid. Now what happened? The blood cells are acted like a dust particle, and it gets stagnant inside the blood vessel. This is what we call it as a blood clotting. You got the point? Sometimes you might have get a lot of news. The people those are affected by corona, they get sometimes die because of the blood clot formation inside their blood vessels. Why it is happening? It because this is the mechanism. So now this mechanism, when it will happen? It will happen in the second stage of the corona disease, that is 5th to 10th day. You got the point? So now what is the key factor here? The very first time when you are getting an infection or a symptoms like a throat infection or a fever, you have to tell the doctor exactly from when you have started getting the fever or when you have started getting the throat infection. That day should be counted as a first day. You got the point? So when the first day is calculated properly, doctors know exactly when this particular cytokine storm will happen. Whatever I have explained, that now it is nothing but a cytokine storm. That is, antibodies are moving inside the lung along with water composition of the blood, and it leads to the lung swelling. That is the condition called cytokine storm. Okay, initially it will act like a cytokine shower, then it will go for a cytokine storm. It is clear. Now, if the doctors know that exact date from where the symptoms are started, when the patient comes to the hospital, they will start the proper planning of the treatment with the steroids or whatever else they need to be done. They will do it. So now what the doctors will do? They'll give the steroids. Why they are giving the steroids? Because you have to suppress our immunity system, because our immunity systems are become overexcited and it produces large amount of antibodies. That antibodies are creating a havoc. Meanwhile, the virus, what it does, it plays a major hide and seek role inside the lung. That is one. Okay, that is the specialty of coronavirus. Now, the normal human lung, how it functioning, it means normally the healthy person will use the lung, normally 1/3 of the lung only. Remaining 2/3 we don't use it, because the lung is a very big organ in our body. Normally, say for example, I am speaking as well as breathing, I am using my 1/3 of the lung. Remaining 2/3 it is remain empty. It is almost like you are moving in an Innova car, only driver. Remaining all the seats are free. You can consider like that. So like that only we are using our lung. Now, when the virus is playing a hide and seek inside our lung, along with our antibodies, now what happened? The remaining 2/3 of the lungs is going for gradual damage. But even during that time, if I test my pulse oximeter, if I check my oxygen saturation, it shows remain normal, because oxygen saturation getting the report from the remaining 1/3, not from the remaining 2/3. The person looks everything perfect till the 10th day. After 10th day, what happened? Immediately the people start getting the oxygen drop, because 2/3 of the lungs are got affected and the remaining 1/3 is getting affected right now. Now the saturation oxygen is started coming down. Immediately they will rush the patient to the hospital. But the doctor will say what they can do. It is a delayed admission, delayed starting of the treatment. Now what happened? The doctors, they need to go for oxygen therapy or ventilator or steroids or high dose of steroids. There is no other method. You got the point. Suppose if the patient is immediately approach the hospital in the very first day itself, what the doctors will do, you don't need to go to the hospital at all. Because 85% of patients in corona across the globe, they got cured in the first 5 days. Keep it in your mind. The fever will come and go. You just take the normal Dolo 650, that is enough. Remaining 10 days, you need to be just isolated because not to avoid, to prevent spreading of the disease to others. Okay. So now the whole game in this, the mechanism behind this, you need to identify which is the first day of the symptom, approach the doctor in a proper time so that you can avoid this cytokine storm. When you approach the doctor proper time, the doctors will start the medicine. The mild dose of steroids, they will start from the beginning, the first day itself. That controls your antibody rush to the lung so that the liquid part will not enter inside the lung will not get damaged. The cytokine storm will not happen. Even the cytokine sour will not happen. So that in the first few days, you will be completely alright without no need to go for the high-end risky medical emergency care like ICU and oxygen therapy and other stuff. You got the point. And the last few days it's a completely recovery phase unless until if the cytokine storms are not happening yet. The person looks pretty normal and he become totally out of the danger. Okay, so here the key factor is the second stage, that is the 5th to 10th day. So the doctor is not what normally advising it. If you are getting heavy fever on the 10th day, first 5 days you'll have a fever, it become normal. And again, if the person is having a heavy fever in 10th day or 11th day, that is normally not advisable. It is a clear indication that that person's lung is undergoing for the cytokine storm or a shower. That is why the body creates the fever. It is clear. At least that time you need to rush to the hospital. You should not keep checking your pulse oximeter, and once if the pulse oximeter shows less than 93, then only I'll go to the hospital. That is not the way. Because that means you are delaying the proper treatment well before the damage of your remaining 2/3 of the lung. Okay, so these are the mechanism you need to understand about the coronavirus. If you are able to understand this properly, you can able to cure the disease very very easily in the first 5 days, and you don't need to have much tension about the disease. It's clear. Now, when a person completes the entire 14 days of course along with steroid therapy, now what happens? Steroid, what it does? It reduces your immunity system. Normally it reduces your immunity system. So when the person is coming out of the COVID, his immunity systems are already suppressed. That means he is ready to take other infections like a black fungus, yellow or white fungus, whatever it is we are discussing in the media. All those diseases can attack the person because his immunity system is already suppressed by steroid therapy during the corona care. Am I clear? So it's all post-operative complications. So if you want to avoid black fungus and other diseases, then you have to keep monitor your health. Very first day you approach the doctor and tell them exactly when that symptoms are started. That is highly enough. Rest of the task will be taken care by the doctors. I hope you can able to understand the entire gamut of cytokine storm as well as the complete mechanism about the corona. Thank you. See you again.